The healthcare system is not designed for bodies like me. It's designed for supporting, quote unquote, like normal bodies.
Disabled Canadians experience difficulty in meeting our healthcare needs, even as our lives are shaped by medicine. In 2024, we spoke with members of the disability community, advocates, educators, athletes, and activists about their experiences of access to healthcare. Finding a healthcare provider was the first challenge.
When I think about something really meaningful that comes to mind is actually my recent experience finding a family doctor. So it took me about 6 years to find a family doctor, and I recognize that for many folks in Ontario and in fact in Canada, that's quite a common tale. However, when I would go to what I dubbed the audition, where you would go to meet the doctor and talk about, what your goals were around health and perhaps if it was going to be a fit or a synergy, there seemed to be a lot of concern around taking on a patient who was blind or visually disabled. And I was turned down from a number of doctors.
As with any audition, disabled people aren't always successful in securing the role of patient.
12 plastic surgeons denied my referral. So that's the new thing in healthcare, is that they deny referrals because you're too complex. It's just like the sickest people or the people that need the most care don't get seen because you're considered too much risk. And legally, if they accept a referral, they're considered under your circle of care.
In a couple of cases, the response was, our clinic isn't set up to accommodate you. And I would probe and say, can you talk a little bit about what you mean by, accommodate me? And then sometimes there was kind of fear around stairs, even though I explained that many of us who are blind navigate steps independently and we use a white cane. Sometimes it was around not being able to provide information in a format that wasn't a hard copy piece of paper. And other times it was just kind of simply, I don't think I have the expertise to help somebody with vision loss. So I think there was just a lot of sort of misconceptions and fear around taking on a patient that perhaps would be perceived to some people as more complex and taking a bit more time.
According to Canadian researchers, not having a practice set up to accommodate disabled patients, reluctance to take on complicated cases, as well as concerns that disabled patients would take up too much time to be financially viable or to have high administrative needs, all contribute to provider resistance to welcoming disabled patients. Perhaps as a result, many community members talked about their frustration and worry about visiting a healthcare provider. This could be heightened depending on whether they felt they were also going to face other forms of violence, like medicalized racism.
In 2017, I started having pain in my right leg, and then it spread to my left leg. So I went to my local family doctor and expressed my pain that I was feeling. And they're like, oh, everyone gets pain sometimes. It's okay. Just, continue exercising. You'll be okay. And it kept getting worse and worse. And I was really like, no, I think there's something wrong. I was also dealing with brain fog and other issues. And I kept bringing this back to the doctor. And they finally suggested that I might have fibromyalgia. And so I started looking more into that. But we still going to push. They're like, we don't know for sure. Maybe it's all in your head. And so that was very difficult and frustrating. And I remember my mom's also a nurse. And so she's like, we're a Black woman. No one's going to listen to us in this instance. And so that was really frustrating because she had similar pains when she was my age. And so but I was like, no, and something's wrong here. And so finally I got the diagnosis of fibromyalgia.
I feel like for someone who, as a Black male, it's hard to be vulnerable and it's hard to admit that, okay, medically I gotta go get checked up. I'm gonna put it all on the table and see what's wrong with me, just to get rushed out of a room, and when you're asking questions, like you don't understand. And it hits a little harder with that whole idea of the fact that, first of all, I'm a person who lives with a disability, so people feel that I won't understand when they explain. And then it hits harder because historically, intelligence for a Black male, right? So it's that double whammy of like, do you think I can't understand what you're saying? And the fact that I'm not even able to ask questions when this has to do with my own body.
Once disabled people make it into the provider's office, we're confronted with barriers to being seen and heard as competent commentators on our bodies and experiences.
Every situation is different, but at the same time, if there's a pattern, you can sort of know what's going on. Like for one example that I have is about 2 years ago, I was dealing with spontaneous lung punctures called pneumothoraxes, called the home doctor that visits patients at home, just to get another opinion. Like they said, it wasn't anything to do with the lungs. They said it was a heart thing, but because my heart rate was super high, which is because I had the lung puncture. But I knew the doctor wasn't being informed or taking the time to make the correct decision because my heart is completely fine in all the other tests. And so I knew it was a lung problem. Obviously, I've been dealing with it the whole summer. And I think later that day, I went to the emergency, and one of the doctors was good enough to recognize that, do an X-ray, and get a chest tube in me. That was actually a pretty hectic day. But yeah, that's one of the experiences I've had with healthcare for sure.
I can tell you that in past experiences when I've broken the same hand, I had it cast in a way that was really incongruent with healing. So my wrist is hyperflex, so it bends inward. When I broke my hand previously, it was cast in that way. So the question was asked, can you straighten your wrist? And I said, no, meaning it hurts too much to straighten it. And they took that as, well, she can't extend her wrist. And so they cast it in a very awkward position. So I had to have that recast. So that's an example of them asking for my bodily knowledge, but maybe not asking in the right way or asking enough questions. But then others might ask more elaborated questions, and that would result in better care.
Again, understanding disability experience begins with trusting disabled people's knowledge about our bodies. It also involves being prepared to disrupt the routine clinical practice to make space for the bodies, minds, and personhood of each patient.
When I went to go and get a kidney X-ray, which I did in my chair, which was great, but the technician, I guess, found a kidney, and she was like, I found a kidney, and I'm like, great. And she's like, I can't find your other kidney. I said, well, it's there. Keep looking. And she kept looking and looking. And she must have asked me like 5 times, are you sure you were born with just one kidney? And I said, truthfully, I don't know, but nobody's ever told me I only have one kidney. I think they would tell me if I only had a kidney. If I only had a kidney, I would tell you, just keep looking. It could be that my posture is so different that throughout the years my kidney has moved. Perhaps you should be looking broader. Come to find, my kidney is way off into, like, closer to my spine, which took a really long time to like, oh, there's your kidney. Yeah, there's my kidney. Because the assumption at the first thought was that I was wrong, that they couldn't see it, and if they couldn't see it, then I didn't know what I was talking about my own body.
Not being seen and heard paves the way for interactions that disabled people experience as violent. This is particularly true for those of us who have interactions within the psychiatric system, where medical authority is intertwined with sanism. Healthcare providers' assessments can follow a patient for the rest of their lives. Psychiatric records not only shape every subsequent healthcare interaction, but many other arenas of life, including work, travel, parenting, and housing.
I've been labeled as having serious mental illness, and with that comes a lot of baggage. That label carries a lot of weight, and part of that weight is my medication. And so 5 years ago, I got pretty serious about ending my life, which resulted in a 3-week involuntary hospitalization, at which point I was heavily sedated and polypharmacy to the max. I've been threatened verbatim, saying, I will not hesitate to pull you back here and keep you here, by a psychiatrist who was in charge of my care. And it was absolutely horrific. And I complained to the College of Physicians and Surgeons of Ontario over this. I lost the complaint, but they used a lot of strong language in it, which would suggest it was a bit of a warning. And since then, the discharge documentation had been amended to accurately reflect what had happened and who I was, because that discharge documentation from another later hospitalization with a poor doctor, it said so many mean things and made so many judgments about me and my situation, but she hadn't listened to me to get to know me in any way. I was just a project that she didn't want.
Disabled people are constantly framed as ill or in need of fixing. And yet, ironically enough, the healthcare system is designed for able bodies. Many of the people we spoke with noted that disabled patients were neither anticipated nor accommodated.
In the outside world, booking appointments to see specialists in hospitals have been hit or miss. You tell them, I need, your tables aren't accessible to me. I need a Hoyer lift to get on the table. Can you have one ready? And they're like, sure, no problem, blah, blah. And then you get there and they're like, you asked for this? I'm like, yeah, I did. I totally asked for this. And like, oh, we can't find one. And they're scrambling around for 20 minutes looking, or 20 to 30 minutes looking for a Hoyer lift. And, like I said, with Wheel-Trans, you're at a set time. And if I had booked Wheel-Trans to get there, that's 20 minutes that I could be behind where, I could be left behind. When they want to do things like weigh you and you can't stand on that scale, and, that's a little, disheartening. And it just like, I told you this is my situation, but you're not, it's still very an inaccessible world. No matter how much we've moved forward, there's still a lot of things where, your disability smacks you in your face when you don't really want it to.
Well, one of the biggest gripes I have is a lot of the patient rooms are too small, especially in walk-in clinics, that's just one example of something that's inaccessible. Another one is a lot of the time in hospitals, when it comes to x-rays or transfers, they're not always trained on what the proper use is for someone who has mobility issues or who needs to be transferred, uses a wheelchair. I guess it's not as common, but a lot of the time people they just don't know what to do in that type of situation.
So recently I went for a bone density testing. I had been to this particular place before, Women's College Hospital, and I went by myself. It's right near work. And I went to get on the table and I couldn't get on the table. The table was about 6 inches higher than my chair. And I asked them, what has changed? And it turned, they had gotten new tables. And I tried everything and I could not get up on this table. It was very uncomfortable. It was humiliating. They offered to go and get a lift but at that point I had waited and now I was so frustrated. I said, no, I'll come back. And then I did have to come back with my husband to help me. And that was when I found out that, they had changed the tables. So that was really frustrating.
Disabled people want healthcare providers to learn about accommodations and accessibility.
I feel that it's very important that individuals are trained with accessibility, where if I'm a person who lives with low vision or blindness and I walk into your office and you see me struggling to find where I'm supposed to go, or it's this big hospital where things are labeled in small print, or they don't have braille, or it's just so it's a runaround just to get to the location, then you're doing a disservice to individuals who live with a disability, and more specifically blindness and low vision, because when we're coming in to visit you or we're coming in for an appointment, it's already stressful enough going into the appointment for whatever you need, and then adding the fact that these areas are inaccessible, whether it is environmental, built environment, or even attitudes as well.
Inaccessible healthcare spaces often mean that disabled people need to bring family and friends for support during appointments. But this too can produce ableist interactions.
You know, nothing makes me more nervous than thinking about the potential of going in for a surgery and not being able to read the consent form, or not being able to read the pamphlet with all of the side effects. Not only is it inaccessible, but it's also not good for the trees to have all that paper. So I feel like a lot of times when I'm going into a hospital setting, I'm having to go with a navigator or a support person who can do that reading. And to be frank, a lot of the information about our health is private, and we may not want our friends knowing or our family knowing just yet what's happening, and we want to be able to disclose that as and when we wish.
I got to see this doctor, and I brought a caregiver with me, and the person at the front desk gets up with a piece of paper and a pen and says, "Can you fill out this form?" And my answer is no. And I think we just sit there for a few minutes, because I don't think anybody's ever said no. Right? It's just like, sure. So she's holding this pen and this clipboard and this piece of paper to me, and we're just standing there in a very awkward moment. And then she just gives the paper to my caregiver and was like, "Here." And I say, "Or you could have told me when you were giving me this appointment that there would be information that I would need to fill out, offered to send it to me in advance so I could complete it on my own, send it back to you, in order to avoid me having to give my personal information to my caregiver to scribe it onto a piece of paper."
In addition to the difficulty locating healthcare providers, many people we spoke with found that they also struggled to navigate a siloed, complex, and costly system of care. One middle-aged wheelchair user juggled 20 specialists. The labor of managing this care fell on the disabled patient, work that was made that much more difficult given the system's failure to account for disability experience.
Somebody asked me once, like, "Well, who's managing your care?" I was like, "That would be me." And just like every other disabled person is managing their own freaking care.
I was, diagnosed with diabetes in 2017, and they're like, you're gonna have to do the finger prick to test your blood. I'm like, I'm spastic, I can't do it. So is there something that I can use to do that? And I heard about the Freestyle Libre sensor, so I'm like, maybe that'll work. So, they're expensive. Like, to get two of them, they're about $250 for a month. So you're paying $250 a month for these sensors that last 2 weeks a pop. And, I went through my work insurance, and they're like, because you're type 2 diabetic, you can't get them. And I wrote them a letter, explaining my situation about my spasticity And my doctor even sent them a letter as well, and they still were like, no. You know, and it's just like, why do I have insurance if you're not gonna, and I'm giving you a reason, and my doctor is giving you a reason, and you're still telling me no. Luckily, my wife's insurance covers part of it, so I don't have to, eat the $250 a month.
I found out that my medication was being administered to me or given to me in blister packs 1 week at a time. I've shown in the last 5 years that I can be responsible with my medication administration, and still my request to pick up on a biweekly schedule was declined. And I think that's just so unfair, and it's such an inconvenience for me. I have to pay for dispensing fees every single week rather than just once every 3 months. It is a lot. And the medications I'm on cost a lot of money. Like, I'm thankful I have coverage for it through ODSP, because otherwise I'd be paying $700 a month out of pocket. It costs gas, it costs time. There's often a lineup. Half the time my medication isn't even ready or prepared correctly, and I have to bring it back, or I have to come back the next day to pick it up because it wasn't prepared.
Before I started the treatment, I had reached out to some doctors in the States, and they had come back and said, oh, you need daily bandaging on your feet. And this doctor in Texas, and I was like, okay, thank you for the consult, but how am I supposed to do that? And they're like, well, you would just bandage your feet. I was like, I think you're assuming that I can reach my feet, number one. And they're like, oh, well then you can get someone to do it for you. I was like, okay, but who am I gonna get to bandage my feet every day for the rest of my life? Who is this person? Who's gonna do that for no money, no breaks, for nothing?
I used to rely more on doctors and healthcare providers. There's so many other resources out there to help with health and things. And so not limiting my scope to just, doctors, because again, sometimes they make mistakes and they won't own up to it. And so understanding that hopefully they, can put people in the right direction, but sometimes it's not enough. They don't know how to actually provide that care. And so sometimes with chronic illness, they just want to kind of have that Band-Aid solution, even though it's a long-term, it's a chronic illness and it's for life. And so instead, finding other resources and finding community instead to help understand how have other people survived and have dealt with what you might be experiencing.
Disabled Canadians want to define health on our own terms. We want to leave behind tired tropes of deficit and burden in favor of autonomy and relationality. We want to be seen as our full selves.
Somewhere along the line, I think I heard health defined as sort of the lack of illness. Now, lots of people would consider disability, they conflate disability with illness, and you can be disabled and quite healthy.
The barrier that really is heavy on my heart is the stigma and attitudes. So there's a lot of misconceptions about what people with disabilities can and do in the community, that we go to school, that we work, that we have partners, that we have rich, textured, full, busy lives, many of us, that we can be physically active, whether it's triathlons, trampolining, or just going for a swim. I think there's a lot of conflation with infirmity, illness, and disability, and not an understanding of those concepts as they are nuanced. And I feel like a lot of times when I'm speaking with healthcare providers, it's deficit focused, it's can't focused, or problem-based, as opposed to sort of that empowerment of solution-focused, which is a hope or a dream for the future.
I play sports. So I play power hockey once a week from starting in October till May. And then if we're lucky, if there's a tournament, then that could go into August. And other than that, I have my dog that keeps me active. And, I like to cook. I play video games, anything to keep the mind sharp too.
When I was just 16 years old, I started working out, and that has lived with me throughout my life. I'm 36 right now. And then I also fell in love with long distance running because I really feel that it relaxes you. It is that way where you get this runner's high. So a lot of people don't put two and two together. They think that as a blind person, you're running, like you're gonna hurt yourself. Why would you do that, right?
Disabled people want to build trust with our healthcare providers and are eager to reimagine healthcare that works for everyone, from patient to practitioner.
My family doctor has been key in sort of helping me get the resources that I need in a lot of ways. Like there are a lot of maybe forms or things that my family doctor would have to verify. Like for example, if I need accommodations at school at TMU, like this semester, I've had to miss a lot of classes because I was sick. So my family doctor, who obviously knows me, can verify something like that. I have a very specific nutritional needs, and there's some foods that make me cough or aren't good for my weight. So that's another thing is that, my doctor, has written me a note that I can have like special liquids or substances that I take with me into an event venue, for example. So I think having a good relationship and with a doctor such as your family doctor that you can trust and knows you understands your needs is key.
I remember during the pandemic, I started looking to telehealth and like online services. And so that was a huge way that I was, my doctor kept asking me to go in, and I was scared because, COVID. And so I started looking into telehealth and using that service instead, for just my, women health as well. And so looking at all these different avenues, my mental health is also something I looked into and what that actually meant, and giving myself the ability to, seek out mental health professionals on my own terms.
I'll tell you, it takes a lot of work to find a good physiotherapist. And what I mean by good, I think someone who really attends to your own personal base. And I thankfully have a physiotherapist right now who really understands that I have a particular way of being in the world that allows me to be active and independent. I know independence isn't always the goal, but for me sometimes it is. And he really works with me to maintain that base. And as opposed to other physiotherapists I've worked with who are very sort of motivated to get me to sit up straighter or things like this. And, in my 40s, these are not things that I'm concerned with at this point. Being able to walk without pain is more important to me.
Yeah, health means a lot of different things to me, whether it's mental, physical, emotional, social. But I think at the end of the day, it means feeling like you're supported, feeling that you're in a good spot on various different levels, and just having hope. One of the, when after I had lung punctures and they were sort of going on and off, sometimes the treatments worked, sometimes they didn't. But each time you got knowledge or, treatment or advice that was different or that was tailored to you, something you got was hope. And sometimes that's the best thing a doctor can prescribe, to be honest. So, I'd say just making sure you have hope and treatment options that, make you feel as supported as possible.
Disabled community members want access, autonomy, dignity, and equitable resources. We want hope, not for cure, but for collaborative and affirmative relationships that enable us to realize our own definitions of health.
We need to be at the table in ways that are meaningful and that produce something, because my breath is finite, but I have a lot to say. And so, but I'm only going to say it if someone's going to listen.